before we go into specifics about vaccines, let's discuss some of the general queries people have asked us to ask you. And the first question being, how accurate are the new case figures here in Thailand?
I don't believe that they're very accurate at all for a couple of reasons. You know, when you talk about case accuracy, you have to talk about case testing, right? And we know that early on in Thailand, there was actually, I don't know, there was what I would call a hesitance towards doing a lot of testing, which I agree with in a number of ways I'll tell you about later. What happens is once cases start to ramp up, so does testing. And anytime you test more people, you get more cases. And then when you have those positive cases, then you have to realize how you're going to put them in statistically. You know what I mean? Yeah. So like if you get 1,000 new cases, all of a sudden somebody thinks that's 1,000 new deaths, and it spreads an unwarranted fear, right? When it could be, 965 asymptomatic infections, and then, a few people went to the hospital because they were mandated to. So I don't think the numbers are very accurate. Like I said, the numbers are as accurate as the testing at any given time.
So what percentage do you think is wrong? You think it's 2 times this, 3 times this, 10 times this, or you just don't want to predict?
I've got no crystal ball for this one, really. You also have to understand that a lot of the testing now is being done in clusters. For example, when the infection was alleged to have started in the Myanmar migrant workers camp during the last wave, the smaller wave, those were massive clusters. And if you look at Singapore, remember Singapore at one time had thousands and thousands of cases, and they were all from the migrant barracks where everything is being contained and spreading within itself. Whereas in the rest of Singapore, there were only 25 cases. And this is why when you just put cases out there, it creates not a really accurate representation of what might be going on.
So it's more than you think it is just now, yeah? It's more than what's being said just now. That's your thoughts, yeah?
Yeah, I don't think that COVID ever left Thailand, to tell you the truth. I think, I think it's just been kind of slow burning. It's literally impossible to clear an entire country of an infection. There's always going to be subclinical infections that people are getting, and then all of a sudden it hits it's like lighting a match and putting it in the wind, and then all of a sudden it hits some tinder somewhere else, and all of a sudden you have a fire.
Okay. On the present figures of around about 2,000, 2,500 a day, yeah, on the general public, as opposed to the prisons, yeah, not that they're unimportant, but in the general public, do you think the hospitals and the field hospitals can cope with this growth per day?
Well, that's a very good question. Let's talk about what the hospitals are being used for. Now, I do consultation on COVID infections all over the world every week through Teledoc. I'm one of their consulting doctors. So we get calls from India, a lot of calls from India, as you could imagine, calls from the States, calls from Spain, calls from Europe, calls from Egypt. And it all depends on how the government is managing these things. Okay, there's other countries that have less medical capacity than Thailand does, yet they're managing it different. For example, in Egypt, if somebody has COVID, the government tells them, talk to your doctor, they screen them. Do you have symptoms? Are you short of breath? Do you have a fever? Do you have things that need to go to the hospital? And of course, in the grand majority of the cases, they don't. So the people are mandated stay home for 14 days, isolate, and they self-quarantine. Thailand has a different approach to it, where if you're positive, they quarantine you in a group of a lot of other people, and that place that they're quarantining people is in the hospitals. So there's a lot of people in the hospitals that don't need to be in the hospitals. Yeah. From what I understand, and I would need to be corrected on this, I don't believe that the ICUs are filling up. The death rate in Thailand is about the same as the death rate all over the world. It's under 0.4%. So I don't think we have a very accurate view of things. And like I said, most other countries, and the ones that I work with, they don't tell people to go to the hospital when they have COVID. They screen them, triage them, and tell them to stay home with their family and isolate for 14 days. And I think that's a very reasonable thing to do so that you don't burn out your hospital capacity.
But is the government basically saying that, as we were discussing before, number one is if they're with the family, should the whole family be isolated? Because if one person's got it, the likelihood is you're going to pass to the rest of the family. So just because that one person has it, should the whole family isolate? And also, is it because the government do not trust the average person to discipline themselves to stick by it?
Well, I don't think any government trusts the average person. You talk about that.
But, I don't trust myself.
Yeah, but no, it's a very good point. And like I said, this is what most governments are doing, just so they don't run out of their capacity, is they're doing proper triage. You know, it's the same thing in medicine. Like I give patients instructions what to do, and you know, I hope they're following my advice most of the time. Yeah. But again, when it comes to a matter of isolating a deadly infection, for instance, right? Here's a good contrast to it. So I worked in West Africa during the Ebola epidemic. Okay, I was in Liberia and I was working in 4 different Ebola camps and running them. Now, Ebola, as we know, is a highly deadly disease, and it had a mortality rate of over 50%, depending on which country you were in and what was available. So there, the same thing, the spread was as bad or worse than COVID-19. So then if we had a family that was exposed, absolutely, they were all taken and put into quarantine. And that wasn't a home quarantine, because if these people did travel in their village or go anywhere, then it meant a lot of other people were going to die, because this was a horrible, horrible, most deadly disease I've ever seen in my life. If you contrast that with COVID-19 or even with the flu, when we find out that a family has the flu, we don't isolate them, right? We tell them, you know, stay home if you have the flu, don't do these things. But all of a sudden, you see COVID's kind of being treated like Ebola with people. Like, get them out of the house, put them into quarantine. In my experience in other countries, you can trust people to quarantine themselves. And then you have to look at the risks and the benefits of doing so. So the risk of doing so is that people are going to, you know, get cheeky about it and say, well, you know, I feel fine, I'm not going to spread it to anybody, and they might break the rules a little bit and spread the disease. The benefits are that you're not putting people in a hospital who don't need to be in the hospital, because hospitals should be your last line of defense, with the ICU being DEFCON 5.
Yeah,
you know?
Is that where the field hospitals and these hotel, what are they called? Hospitals, they are more for the people that are not in serious condition but have tested positive. So they could be asymptomatic. Correct. Or whatever, yeah? So my
Correct.
other big question here is, are the public avoiding being tested because they don't want to be marshaled off to one of these field hospitals where, you know, they're not allowed to see relatives? They're obviously, their lifestyle has completely changed around for 14 days. So do you think the Thai way is, I'm going to stay at home, and for as long as I have to stay at home, I may have it, I may not have it, but I'll pretend I have got it. So I'll always wear the mask. I'll be careful in my habits, and when I go out, and wash my hands and that. Do you think a lot of that's going on?
That depends on the level of fear that people have from COVID and the level of information coming out about it. Now, in this country, there's a tremendous level of fear, even in people who, you know, would not be potential victims of COVID-19 death, which is most people. So just to review those rules, if you're under 70, if you're healthy, if you don't have diabetes, obesity, some kind of chronic disease, asthma, COPD, you know, any kind of chronic thing, you have a 99.6% chance of surviving COVID. You'll get a bad man flu. You'll be miserable for a few days, but you're going to survive, right? I think a great number of Thai people feel that each and every one of them, even if they're 25 years old, is going to die from COVID. Therein lies a problem. So what happens if these people test positive, they will go to the quarantine because they're afraid they're going to die.
Yeah.
Right. And then there's the other group, which I would imagine would be more in the expat community, that says, you know what, I got some education on this. I got the sniffles. I don't really feel that bad. And I don't want to sit in a room with 200 other people for 14 days. I think that group is going to stay home. And this is why going back to your first question, this is why we're not getting accurate numbers, and it's a best guess.
Yeah. Yeah. Okay. So basically, it's the fear of that tiny percentage is what's making people go and get tested.
I think so. Yeah. I mean, because I would say in the type people that I speak to, the ones coming into my clinic, because our clinic is still open, we're still seeing people. I would say about 75 to 80% of the people that I talk to, and this is of all ages, including young people and healthy people, have a tremendous fear of getting COVID. Even college students that I talk to, if I get COVID, oh my God, what's going to happen? But see, on the other hand of it, I talk to COVID patients every week. You know, I talk to 10, 20, 30 COVID patients a week. So I see the smattering of symptoms. And I can tell you, in my estimation, in my experience of doing this now for 9, 10 months, every week, talking to people, the grand majority of the infections are flu-like illness. You know, where people, you know, in fact, I have a lot of people calling me and they say, do I have COVID? You know, and we ask certain questions. Have you lost your sense of smell? Have you lost your sense of taste? The amount of people that we talk to that we have to send to a higher level of care is an incredibly, incredibly small percentage. So, but I have that education, so I'm not that worried about it. And, you know, the people I know, and in my clinic, what we do is we bolster people's immunity so that they don't have to worry so much about it. So if they get an infection, it's either going to be asymptomatic or, you know, they'll have the sniffles and won't have to go anywhere. But I do understand the fear of people going through social media and seeing, you know, if they see one COVID death, they identify with that as opposed to the 99.6% of
they
people.
can't see the ratios. They just look at the worst possible. Yeah. Okay.
So exactly, and this is where the education process on COVID becomes very, very important.
So with regards to things like masks, I mean, the US now have said that there's less importance of wearing masks, and now it's becoming probably, you know, the individuals making that decision in the US, but here it's mandated you have to wear a mask outside your own home. Yeah. How much difference does this mask actually make?
It's a hard question. I'm a believer in wearing the mask in appropriate situations, and quite honestly, I can't really understand the ire from my. I'm American, of course, and I can't understand the. You know, the planting the feet in the sand that the people in America are getting. I'm not wearing a mask. Nobody, you know, you're not taking my personal rights.
Agreed.
I'm like, oh my God, is this really? Do you have this much time during your day where this is your battle in life?
Present time,
you know
yes.
Put the mask on. Put the mask on. You know, put the mask on. Shut up. Go about your day. I think masks are very helpful.
I think we've just lost Erik for a moment there. We'll try and get him back. Just stay with us. So it's interesting anyway, so far I've gained much more knowledge just from speaking to somebody that knows what they're talking about.
Yeah, absolutely.
You know, transfer of information.
Yeah.
Which is what he's just said. The information is not maybe coming over. So that's why people are frightened. If they knew what he knew, people may be a bit more carefree.
Yeah,
but if people were more carefree, maybe the spread would be worse. So maybe the fear factor is not necessarily quelled by governments because they want to have that fear factor.
Well, also I think it's also the government with the confidence in the people as well. But there's going to be abusers in every society. Yeah. So
I'm getting in my ear. We've lost the connection. Are we back there, Erik?
You're back?
Oh,
right,
cool.
So, so what we'll do is we'll start.
You know, if I was a conspiracy thing, somebody might have stepped in.
Yeah, let's talk about that.
Okay, so let's go back to the last question. So what about the effectiveness of using a mask? Yeah.
I'm sorry, say that one more time, please.
The effectiveness of using a mask. What's the effect? Is there benefit from it or not? Or is this just one big controlling factor to focus people on the situation?
Masks protect other people from you. Okay, masks don't really protect you except that you're not touching things and putting them around your mouth so much. And we know that COVID is more of an airborne than a surface. You know, the surface theory has been pretty much driven down, that this is not a surface-driven type of infection.
Really? Because I actually was always warned that, you know, watch the surfaces, avoid, don't touch on the escalator, don't touch things. And so it's not a matter of just touching.
Well, yeah, I mean, that's a good policy, but the studies that they did on it showed that it actually does not exist on surfaces for as long as, unless you put it in ideal clinical conditions, which, I don't see at MBK. It doesn't exist on surfaces for that long, so it's airborne. So the mask does protect other people from you, and it's good for that regard, and I support it. And I think it's a good thing in general to do if you're potentially sick.
Right. Okay, question here. In the beginning of the outbreaks, when, I don't know how much more we've learned from the very beginning, to be honest, and I feel sorry for people in power that have to make these decisions and then change them 24 hours later. And, they're changing their mind now, but it's forever going on. But there was one variant. There was one. Now you've got the UK variant, the Indian. Is there a difference? And what is the difference between these different
variants? Well, the difference in the variants doesn't have to do with any of the lethality, because the death rate throughout all these variants has not really increased, and there's a couple of factors having to do with that. But you have to understand what a virus likes to do is to live. So what a virus likes to do is to live and spread and replicate. That's the job of a virus. If a virus kills its host, then it can't do that. That's counterproductive to its survival, right? So what these mutations have done has improve the spread of the disease and the transmissibility without increasing the death toll or the lethality of the virus. Okay.
They're clever, aren't they?
In most cases, although they're still getting data, the vaccines still work on these variants, on most of them. But as time goes on, just like with the flu, they will have to develop vaccines that are more specific for each mutation, depending on what the dominant mutations are. Okay. But, does this mutation mean we're going through the zombie apocalypse? No, I don't think so, because this is not a lethal virus like Ebola. And this is why Ebola didn't keep spreading, because it killed its host too quickly, right? So Ebola was not a perfect virus.
Yeah. All right, I think we can move on now. That was a good segue.
We just have to think the one question about the herd immunity. Yeah. People are talking about herd immunity, 70%. You have to get for the vaccines to be covered. How does that work, and what is the aim of herd immunity? Is it that basically people won't get it, or there's people have built up an immune system to it, or how does that work?
Herd immunity means when you get enough people in the population who develop antibodies. The antibody production is what kills the virus in the body. Your body makes antibodies, virus enter your bodies, antibodies kill it, which means you either get no infection or a subclinical infection where you don't know you're sick, or you get a very light infection, right? And that has to do with the degree of antibody production that each vaccine does, which I believe we're going to talk about. Herd immunity is when you have enough people with antibodies that the disease is going to burn out. It's not going to have a chance to spread, right? This virus is not going to live forever. If you have COVID, Andrew, and you cough it out into the world, it doesn't just sit there forever waiting for a host. If it doesn't find a host, it dies, from sunlight and oxygen and everything that is not an appropriate environment for it. Herd immunity says where you don't have enough people for it to spread to, so it dies off.
Okay, I think one quick thing, is I was asking before, for people at home, you said that the surface issue is not really an issue. But the recommendation for restaurants, for homes, etc., is clean with alcohol and do all this. But is it just going to die within a matter of hours or days, or at what point?
Well, if you're cleaning it with, if you're in a hot place and COVID gets on the table, it's not going to be alive probably for more than a few minutes, to tell you the truth.
Right.
So that
was very important.
Thank you.
Okay. All right.
Right. No, I'm not saying. Listen, I'm a clean freak. Believe me, I wash my hands like in medicine. I wash my hands like 20, 30 times a day. Sometimes that's the appropriate thing to do. You should keep clean. You should clean your surfaces. When you clean your surfaces, you get rid of all kinds of other bacteria and funguses and viruses and things you don't want in your body anyway. And there are certain circumstances where, somebody coughs on the table, you sit there, you're putting your arm in it, then of course it could spread. But the point I was making was, at first, you were talking about the recommendations for everybody. And at first it's on a surface, you're going to get it. It's in the air, you're going to get it. It's in the subway, you're going to get it. And there's been lessening of this amount of fear of each way of transmission now that the science has come out further. And believe me, if this was surface spread, each and every one of us in Bangkok would have it already.
I do have one. I know I'm the one trying to move this on. I've got one question for you. And it's a basic, so how is it transmitted? How could I possibly, I mean, unless I touch a surface that had something on there, some phlegm or some whatever it is, 2 minutes, is that how people are catching it then? Or are they catching it from the air where then the masks do come in handy?
They're catching it from the air. Okay, and that's where the masks do come in. Okay. That's the grand majority of way. And people living in close quarters who are having not just one single exposure to it, but multiple
like prisons
exposures to it during the day.
Okay.